In this video, we will discuss ATRIA score. This score is used to predict the bleeding risk in patients with atrial fibrillation. First, let's go through the indications for its use. ATRIA score can be used to predict bleeding risk in patients with atrial fibrillation in whom anticoagulation therapy is being considered. In addition, it can be used to estimate bleeding risk for patients already receiving warfarin therapy. Now let's quickly go through anticoagulation and risk factors in atrial fibrillation study, which was instrumental in developing this score. This ATRIA study was undertaken to develop risk stratification score to predict warfarin-associated hemorrhage in patients with atrial fibrillation. A total of 9,186 patients with non-valvular, non-transient atrial fibrillation were included in this study. Clinical databases and medical records were reviewed for identifying risk factors and validating hemorrhagic events. So, after statistical analysis, 5 variables were derived, and these variables were weighed based on their effects on the bleeding risk and then accordingly allotted points. And finally, Cox regression model was used to develop hemorrhage risk prediction score. 6 published hemorrhage risk schemes were used to validate this risk score. Now let's go through the pitfalls of this trial. The patients at the higher risk for major bleeding were likely to be already pre-excluded by clinicians. In addition, the study population was taken from the patient population with the excellent follow-up, and the patient's INR and potential compliance were not taken into consideration. So all these factors may have led to selection bias. Next, second important drawback of this study was the 6 hemorrhagic risk schemes which were used to validate ATRIA score did not include HAS-BLED score. And as HAS-BLED score was found to have better predictive accuracy compared to all other risk scores, non-comparison of ATRIA score with HAS-BLED score was a major drawback of this study. Now let's see the risk factors which are incorporated in the ATRIA score. The first risk factor is anemia, which is defined as hemoglobin level less than 13 gram per deciliter in males and less than 12 gram per deciliter in females. The second risk factor is severe renal disease, which is defined as GFR less than 30 ml per minute or dialysis dependent patient. The third risk factor is age, equal to or more than 75 years. The last two risk factors are any prior hemorrhagic event and history of hypertension. The first two risk factors, anemia and severe renal disease, are allotted 3 points each. The third risk factor of age is allotted 2 points, while last two risk factors of any prior hemorrhage and history of hypertension are allotted 1 point each. So there are total of 10 points in ATRIA score. Now let's see how to interpret ATRIA score. ATRIA score of 3 or less than 3 classifies patient in low risk group with annual risk of hemorrhage being 0.76%, and in this patient it is reasonable to start warfarin. ATRIA score of 4 classifies patient into intermediate risk category with annual risk of hemorrhage being 2.62%, and in this patient alternatives to warfarin can be considered. ATRIA score of 5 to 10 classifies patient into high risk category with annual risk of hemorrhage being 5.76%, and alternatives to warfarin should be strongly considered in these patients. Now let's briefly go through the trials which compared ATRIA score with other risk scores. The first trial by Ham et al. Compared ATRIA score with stroke risk prediction scores in patients with atrial fibrillation not using warfarin. In this trial, ATRIA score was found to be better in identifying low-risk patients compared to stroke risk prediction scores. Then the second trial by Roldan et al. Compared ATRIA score with HAS-BLED score in patients with atrial fibrillation on anticoagulation therapy. This trial showed better predictive accuracy of HAS-BLED score compared to ATRIA score. Then the third study, Amadeus study, compared ATRIA score with HAS-BLED and hemorrhage score in patients with non-valvular atrial fibrillation on anticoagulation therapy. In these trials, though all three scores showed modest performance in predicting clinically relevant bleeding, compared to the other two scores, HAS-BLED score was superior in predicting clinically relevant bleeding. In addition, HAS-BLED score was the only score that showed a significant predictive performance for intracranial hemorrhage. Now moving to fourth trial, Sinau et al. Compared ATRIA score with HAS-BLED and ORBIT score in patients with atrial fibrillation on anticoagulation therapy. These trials showed significantly better predictive accuracy of HAS-BLED for predicting clinically relevant bleeding. While Sinau et al. Compared ATRIA with HAS-BLED and ORBIT score in patients with atrial fibrillation on warfarin therapy, Lepp et al. Compared these scores in patients with atrial fibrillation on non-vitamin K antagonist oral anticoagulants. In this trial, though all three scores showed modest predictive value, HAS-BLED was found to be more predictive compared to other two scores. With major bleeding risk threshold between 1.7 to 2%, major benefit was observed with using HAS-BLED score, while with the threshold between 2 to 6%, that is with higher major bleeding risk threshold, both ATRIA and ORBIT scores performed better. Now moving to sixth trial, Yaus et al. Compared ATRIA score with CRUSADE and acuity bleeding scores in NSTEMI and STEMI patients receiving antithrombotic therapy. The predictive value of ATRIA score in predicting major in-hospital bleeding was similar to CRUSADE and acuity horizons bleeding scores. So, ATRIA score is useful risk score for predicting in-hospital major bleeding in STEMI and NSTEMI patients without atrial fibrillation. In addition, compared to CRUSADE and acuity scores, ATRIA score was easier to calculate and had similar accuracy. Now, after all this discussion, let's see the final conclusion about using ATRIA score for predicting bleeding risk in patients with atrial fibrillation. So, in combination with other risk stratification scores, HAS-BLED score in particular, ATRIA score can be used to help guide the decision regarding warfarin therapy in patients with atrial fibrillation. So, these are the references you can go through for further details.